Let's talk of polycystic ovarian syndrome and whether the problems that it causes are also due to inflammation. PCOS is one of the commonest reproductive medicine challenges that we see. Is it just about hormones or is it also about inflammation in the body? So, what happens with inflammation is the body's natural response to things like injuries or infections. But there's some evidence that PCOS is a type of a low grade silent inflammation that is always lingering in the background. You can see it in some blood tests, especially in some cases with higher CRP, C reactive protein. And the question is, why does it happen? It's quite complicated, but here are the main causes. First, insulin resistance is common in PCOS, even in women who aren't overweight. This means that the body struggles to use insulin properly, leading to high blood sugar and more insulin circulating. This excess insulin triggers ovaries to make more androgen versus PCOS. Also turns up inflammation in the body. Second, the extra androgens, which are the male hormones themselves, can make fat cells misbehave, causing them to release substances that promote inflammation. Third, even when women with PCOS are not obese, the background of hormone and immune system disturbance creates a cycle of ongoing inflammation. Family genetics plays a role, and some people are simply more prone to these changes. And what does this mean to health? Chronic inflammation in PCOS isn't just a lab finding. It increases risks to heart disease, diabetes, high blood pressure, and even raises the chance of miscarriage. About half the women with PCOS are obese, but even lean women with PCOS show signs of inflammation. So now let's go on to treatments. First, lifestyle changes like healthy eating and regular exercise are the key. They lower inflammation, improve insulin sensitivity, and often restore more regular periods. Medications such as metformin, minoxidil, commonly used to decrease insulin resistance and sometimes used in diabetes. Supplements such as minoxidil have been shown to show promise in improving symptoms and lowering inflammatory markers. In some cases, anti inflammatory diets, rich in fruits, vegetables, fatty fish, and whole grains, may be useful. Finally, monitoring, including checks for blood pressure checks, cholesterol, blood sugar information markers like CRP, can guide you. If you're trying for a pregnancy, address these and think of starting ovulation induction. So, the bottom line is that while it may seem like a hormonal problem, there may be an element of chronic inflammation associated with it.